Hi, I'm Ramya Subramanian. I'm CEO, COO, and co-founder of Docty Inc. So there are so many, problems that you see in healthcare. Not only do we see that, healthcare is obviously a problem. There's no much access that you have that everyone gets. So care fragmentation, I feel, is one of those core issues that everyone faces in day-to-day life. As a citizen of this world, I think everyone should have access to healthcare. Of course, there's very high costs that everyone faces. If you're rich, you're able to have access to that and get the best benefits. And if you're not so well off, then you don't get those benefits. Also, technology seems to be playing a very big part in, who and how we get access to healthcare. So if you're in the remote villages, say for example, there's not much technology that takes you there and you have access to healthcare there. Well, in the big cities, in the metropolitan cities, everyone gets to have the best of healthcare, at least access to healthcare. Another one of the things that I've noticed is people who are in the low risk factors. When you're younger, you don't have many risk factors that you are facing. The middle age, between 20s to 40s, you can actually take care of your health by just eating good food, exercise, all of those fun things that you can do in day-to-day life, and make sure your risk factors are low. What about the people who are on the brink of having multiple chronic factors, or on the risk? That is, I think, is the major part that all healthcare platforms or all healthcare entities must concentrate on. So when I started off, I call myself a serial entrepreneur because almost from the time that I was 20 years old, started multiple businesses. One was in IT, and I've been running an IT services company for the past 15 years. And through that, when we had this idea of making sure that we actually give access to all, which is what Docty stands for. We started off, this was before the COVID, of course. This was 2018 when we started putting some ideas together using our existing IT services company, put together a prototype, took it to the market, got some good validation from the market, which let us know that we are on the right path. That's when COVID hit us. Then, unfortunately, it's all the more validation that our product or our platform is on the right path. And that's when we actually sprung off another entity, which is Docty, which we started off. And right now we are in 3 locations. One is in the US, of course. Then we have in the LATAM, which is the Latin America region, in South Africa, and in India, we started off in October 2021. We have integrated the entire ecosystem into one platform, and we use artificial intelligence, which absolutely makes life easier, where you put in your condition. I have a headache, I have a backache, and then through a list of questions through AI, it comes to a conclusion, not a preconceived conclusion, but 96% success rate, which we have through our AI platform, where it tells you this is what your condition could be, and these are the list of doctors in your particular area who you can consult, and then you go on to the next steps. Now, is that only what Docty is about? Absolutely not. So Docty goes beyond consultation, and that's when I said, we have the entire ecosystem within our platform. So as a patient, as a citizen of this country, of this world, I want to look at healthcare from a patient point of view. Now, everywhere you go, you don't have any system or any solution given to you that is patient-centric. You have something that's insurance, could be hospital, could be a clinic, could be just your tests, your diagnostics. What if all of this is under one platform? So I put in my name, Ramya Subramanian, 44, female. I have 2 kids. I have a husband. All of that in one platform. I say this is my insurance that I use, or if I don't, it's fine. I say this is my doctor. This is the hospital I go to. I put it, or this is where I get my tests done. I put it all in my platform, and in one shot, from the time I put in my symptoms to the point where I get my results done, I have all my records in one platform. Now tomorrow I change my mind. I have moved from one location to another. I don't have to go behind any of the hospital or my, the medical centers to find out where my records are. I go with my records. Now that interoperability is one of the best things that we have with Docty. And what this actually means at the end of the day is that we're democratizing healthcare. I think that's what every citizen, every patient, every person in the world needs, to democratize. I know this sounds like a word that could, shake, ruffle a few feathers. Absolutely it will. And I think we are here to do that, just that. Because I have put myself and our co-founders have put ourselves in the shoes of the patient and see what is it that we need. We have parents in other countries. What would they need? How can I monitor their health from here? And all of that put together, I think, is what makes Docty a platform to reckon with. Right now with COVID, everything looks very bleak. Unfortunately, we are all trying to, try to get 2 steps forward when we pull back 3 or 4 steps back. So what is it that, Docty as a company can do for the future in healthcare? I spoke about democratizing healthcare. Absolutely, that's something that we can help with. Number 2, I think with, the kiosks that we have planned, we started off in India in October. And right now we have about 100 kiosks that are going to be set up in different locations that is creating that access to all that I was talking to you about. And by doing that, people with no means whatsoever can go up to that kiosk and actually, put in their symptoms, have a doctor on demand, speak to them, find their systems, and find their, solution and take it from there. Is that one way of doing it? Yes. The other way absolutely is through, government collaborations. We absolutely need to work with every single government where, Docty is. One of the best parts of Docty is also, I don't think I mentioned this earlier, our solution is structured in such a way, and of course we have our data privacy, it is structured in such a way that within 4 to 6 weeks, we can set up our platform viable, abiding by every single rule of any geolocation. So I can pick up my platform, go to Saudi Arabia, I can go to Europe, I can go to Australia, and within 4 to 6 weeks, set it up in such a way that we're abiding by all of the data laws that are in that particular region. So I think our future is right there. We're on the brink of that step forward, and I think Docty could absolutely help get to that point where, with the collaborations of the different governments, absolutely, right now, until now, we have been self-funded, and I think we are absolutely ready to move to the next stage where we can get seed funded and move to the next level and take it to very different regions all around the world. So one of the things that is very important to see in this future in the healthcare region, right? Where does it head? Where can Docty or any healthcare company move towards or look for in the future? I think we've really just touched the tip of the iceberg here. And I think the future for Docty and for others, if they want to just be part of this, is wearables, wearables, and wearables. And I think, for us, we've already implemented and integrated our wearables. By wearables, I mean Docty watches. It's not like the regular watches that you have, your Apple, your Androids, the Samsungs, where you're checking your heart rate, your steps, it's time to stand up. It's not as rudimentary as that. It goes beyond that, because this is now integrated to our Docty platform. It tracks for risk management, your chronic conditions, where you're able to see, like, instead of lying down as, you have to go to the hospital and, put in a few wires and you're lying down and the doctor or the nurse is monitoring you. That's not required. Your Docty watch is what is going to monitor your risk management and the chronic ailments that you have. And I think that is absolutely the future. Is that something that's already implemented? It is. In our LATAM region, Docty Colombia, we've already implemented that, and it's doing very successfully well. This quarter, 2022, is when we're bringing it to India, and you will actually see such a good shift and use for our Docty wearables.